You have this constant noise. There's a lot of people with tinnitus that are underserved, and people were traveling hours to see specialists. We can help people communicate better.
Imagine if you had a ringing in your ears that never stopped, day or night. That's the problem that Dr. Ben Thompson set out to solve. He's an audiologist and the founder of Treble Health, a startup focusing on tackling tinnitus. In this episode, we dive into how he scaled the company and how he turbocharged its growth with a YouTube channel that's been viewed over 10 million times. Let's dive in. Well, Ben, thanks so much for joining us today. I'm really, really excited for this conversation.
Happy to be here.
I'd love to hear a little bit more about the very beginning and what drew you to audiology school, if you imagined ending up doing what you're doing right now, and what Junior Ben, the student, was thinking a couple of years ago that kind of drew him to this area to begin with.
Yeah, absolutely. So as an audiologist, we specialize in hearing loss, tinnitus, but even more zoomed out than that, communication. Communication is the fabric of social connection, which brings so much fulfillment and meaning to life. So when I first got introduced to the field, I thought it was really neat that we can help people communicate better and listen and understand their loved ones. So it was this blend of helping people, working with sound and health that really piqued my interest. And then during my graduate school in San Francisco, I was introduced to the specialty of tinnitus. Now, previously, I had gone to music festivals, gone to concerts, been around some loud noise, had tinnitus, and in the actual work of patients who have ringing or hissing in their ears, I noticed that it was very like human connection based, where it was not just take a pill and it gets better, or use this device and it gets better. This is a really challenging problem, and I learned that patients who deal with tinnitus experience a serious problem that the medical system at large does not have great education for doctors on what to do with these patients. And also the treatments are somewhat limited, or they need a lot of specialized training on how to do them well. So there's a lot of people with tinnitus that are underserved and struggling. It's a condition that affects stress, anxiety, sleep. It can really turn people's lives upside down. So I connected to it because I'm someone that likes to help people. I have a more holistic or, comprehensive view of health. It's not just the ear, but it's the brain, the nervous system, and how that all comes together. So that was how I got into the field and completed the residency at UCSF Medical Center. And I felt like, okay, I have a high level understanding of what tinnitus treatment looks like, and I had skills to back it up. What led to starting Treble Health was that I saw an opportunity to use technology to essentially solve this patient care problem better. There was a huge accessibility issue where people were traveling hours to see specialists, and there are just such a low number of specialists for how many people have this problem. So living in the Bay Area in San Francisco, having friends that worked at tech companies, being around startups, I guess I had kind of permission or an example of, maybe I can try to do something different here. And then I had a patient who drove 4 hours to see me for an appointment in San Francisco. They came from Lake Tahoe, which is a very long trip. So on their chart note, when I had this appointment in San Francisco, David, when the patient's address at Lake Tahoe, California, I had to ask them, like, did you really drive here from Lake Tahoe? And they said, yes, I've already been to my local primary care physician. I saw a local ENT doctor and an audiologist, but they gave me nothing. Then I went online and I found UCSF tinnitus treatment, and I drove to San Francisco for the appointment. And
Wow.
that whole appointment could have been completed via telehealth. So for me, that was an aha moment of, maybe there's something here.
I mean, what an incredible journey for you, and what an incredible insight that was kind of landed right in front of you that you were starting to notice. You've kind of alluded to the experience of having tinnitus, and sort of the desperation and the impact on all other corners of someone's life. Could you just put yourself in the shoes, or your own shoes? It sounds like you've had it before. Could you describe to someone what life feels like? Someone who doesn't really understand what tinnitus is, besides hearing it's ringing in someone's ear. Like, what does that actually feel like? What is the experience of living with tinnitus.
Yeah. Yeah. So about 10% of the population has some significant tinnitus, but 1% of the population really struggles with it. Like it's bad. It's a moderate to severe case. What that typically feels like is you have this constant noise. Usually it's a ringing or a hissing, and it's particularly annoying or noticeable when you're in quiet environments, like when you're trying to relax after work or you wake up in the morning or you're trying to go to sleep at night. This is when the nervous system wants to settle and be at peace and at ease, but we can't because there's this internal sound that often sounds like a high pitched ringing or white noise like a old TV in between channels, or this very high pitched tone that puts the body in this high alert state. So I've experienced anxiety. Most people have, and a lot of people have experienced stress. Right? What does that feel like? Well, the body is tight and clenched. We might notice that our breathing is shallow, our shoulders are tight, maybe we're clenching our jaw, we're not at ease and relaxed. Maybe we're even in this fight or flight response if there's a serious issue or danger. So automatically with significant tinnitus, that's the state that the brain and body are in most hours of the day. So it has a lot of downstream negative health effects from stress and poor sleep. And that's when this one symptom of tinnitus can really create a cascade of problems for someone.
Thank you for walking through that. That sounds like just a massive impact on anyone's life. So let's go back to your sort of light bulb moment or gradual brightening of multiple light bulbs all around you as you're seeing this more and more. It's a big jump to notice an unmet need, and then to build a massive solution to serve that need, and a big career change if you're going from 100% pure clinical practice to I assume 100% CEO life right now on your end. If you could walk us through what happened and tell me more about that.
Yeah, definitely. So, like a snapshot today compared to 5 years ago, very different life. But at the beginning, this was a bootstrapped company. So the first investment that I made was I spent about $1,000 on a camera and a tripod, and I set out to just make YouTube videos. My initial goals at the time were very humble, very simple. I just wanted to be my own boss and do telehealth sessions with patients focused on tinnitus treatment. That's kind of I was sailing a ship in the ocean. That's like the horizon line that I saw. So it was like, okay, well, I want to go there. So basically just kept making videos, and I had so there was 2 years of consideration. I don't want anyone listening to this to think, oh, one day you just decide I'm going to put my face on the internet and I'm going to, risk failure in front of all these professionals that I care about their opinion and all of my mentors and all of my family. It was like a 2-year consideration process where I was slowly, gradually becoming ready to maybe I can try this. Maybe I have the skills for this. Maybe this will work.
That's really cool. And something that's interesting is the pathway that I'm hearing from you is often a pathway that we see in bootstrapped device products, less so in medicine, but this kind of creating the content, building the audience, drawing the community, building credibility. What was that like? Were you imagining that as a strategy, or were you putting content out there as an initial solution to helping people find out more?
So I had some examples. There was, in my profession, there was someone in England who had a YouTube audience. There was someone in Australia who had a YouTube audience. And, whatever justification we can get, whatever, permission we can get to do something, we should give ourselves. So mine at the time, my, self-talk was, well, there's no one in the United States doing this, focusing on tinnitus on YouTube. And I feel like I'm just as smart or, knowledgeable as other people who seem to be doing what I want to do. So maybe I can try it.
That's really cool. And for those listening who haven't seen the YouTube channel, you have a wildly successful YouTube channel that really has zero fluff. It's really just targeted towards tinnitus and solutions, and it's very obvious why you have such a thriving community on there.
Appreciate that. Yeah. We have people who just, give me feedback like this is a great place to have landed on the internet for this condition. Because unfortunately there are, forums, Reddit, other places that are sort of distractions or lead patients down kind of like a wrong path or a dead end even. But yeah, the more and more we do this, I realize that, hey, we have a big responsibility here to, help as many people as we can. And that's essentially been the guiding force here of, okay, we specialize in this one condition. What can we do to help people who have this condition? We have all these free videos, and it's great because YouTube is essentially like a free video platform, where people just get information. And I think as doctors, David, like one of the most amazing things about podcasting or making videos is, yeah, I tell people this, that like sometimes I just put myself in the mindset of, what would I say to a patient if they were sitting in front of me? Because that's kind of the message or the energy of what I want to convey to thousands of people watching a video, which is, if you were in a clinic with your doctor and they were giving you their best advice, it was like, 10 in the morning, they slept well, they had their breakfast, they were energized, they had time on their schedule. Like, what would they give to you then? That's what I've tried to bring to people on the Treble Health YouTube channel.
That's incredible. I mean, so many really valuable pearls and insights for content creation, and you just kind of mentioned one that I think many hopeful content creators think about in terms of speaking to that one person that really needs to hear your message rather than just trying to speak to everyone. And I think that's really valuable for people hearing your channel. Um, I'd love to ask you one more question about content before we dive into your story. I'm curious where you find your topics to share. Is this a byproduct of being so connected to the community that you are aware? Are people messaging you in the comments saying, "Do one about this, review that"? Are you using Google Analytics? Where are you finding topics that are going to resonate?
Yeah, it's really funny because, we've published over 1,000 videos on tinnitus, and sometimes people come to me and they say, how can you make so many videos on tinnitus? It's just one thing. And when I see another health condition, well, how could you make so many videos on that? I mean, but basically just I present it at different angles. The topic ideas. So first of all, we're dealing with something that, like, lacks information already, and it's something that I'm dealing with a condition that actually affects people's like nervous system and anxiety stress centers. So it's not just watch a 5-minute tutorial video and then never touch it again. It's actually like, this is a multi-month treatment or management process that oftentimes people say this is the hardest health condition I've ever gone through. We had a patient who told me, like, I've had cancer, but tinnitus is worse. So a lot of hand holding, as much support, as many, videos as possible. So that's why someone can watch 10 tinnitus videos in a row. Not because they're necessarily so distinct from each other, but because like that reassurance is so key in the phase that they're in. How I source topics is, some combination of like subjective and objective. So what do people need to know about? What do I want to talk about? What topics are, popular or interesting to the masses with tinnitus? And then separately, maybe, objectively, what does data suggest people want to know about? Or, what terms are people searching a lot, therefore likely want to learn about? So things like that.
Well, that's fantastic. I noticed that your company used to be called Pure Tinnitus, and now you've shifted to Treble Health. And I have the sense that there's a strategic, deeper meaning behind that name change. Tell me more.
Absolutely. So pure tinnitus was the best name I came up with in 2020.
It's a great name.
And then as it grew, I started to realize, oh, maybe there's something here. And maybe some people reflected pure tinnitus. And I was talking to my brother, Garrett, who's also an audiologist, and his wife, who works in brand marketing. And so my brother Garrett and I run Treble Health together. So it's a family business component as well.
Mm.
We were in his apartment in Brooklyn, New York, and we were kind of discussing like, okay, we think we need a different name. I didn't like that the ailment or the disorder was in the name. I don't really want to say that word. I don't really want to put more emphasis on that. So that's why we changed the name and took tinnitus out of the name, because I
Mm.
personally feel like this is not something that people like want to connect with or love. This is like a pain point that they want to solve and never think about again.
That makes a lot of sense. That's really interesting. Ben.
So we ended up
Oh,
choosing Treble Health, um, which was a fun, like, those brainstorming sessions of choosing names are so hard. Um, Sometimes it's easier with babies because you're physical, actually, babies, because like, well, this baby is going to be born at a certain due date. So like we need a name and there's no option. But with business names, it's sometimes like they can really drag on. So it can be a hard process to choose a name, but treblehealth.com was available. And
oh
we thought that
wow.
was a really cool, unique thing, because bass, mids, treble. Treble is high pitch, high frequency sound. Tinnitus and hearing loss really affect the high frequencies and the high pitches. And I love health, and the whole company is about health. So it just fit really well.
It's an awesome, awesome name, and it lends itself so well to all different contexts when you're thinking about the problem. And I'm curious, you have a very unassuming way about talking about the journey. Almost like when I talked about the shift from that cliff, jumping from the clinical world into the startup world. You pointed out that it wasn't impulsive. Was there ever a point where or maybe you and your brother were like, not sure if this is going to work, or were there ever any setbacks? Was this just the perfect, easiest ride you could have ever imagined?
Yeah, yeah. So along the way, because it was bootstrapped, we we had I had to be actually making money in order to invest it back into helping more patients and reaching more people. So in some sense, I was proving that it was working before I
Mm.
made a bigger investment.
Mm.
And I think because of that, yes, there's certainly ups and downs and um, challenges, and because we're really trying to help people, but also to exist as a healthcare practice, you also have to think about revenue and um, like being profitable. So as doctors, it's not our instinct to be like thinking like that, but we have to, in order to survive, we have to think like that. So that was a whole learning experience, going through the ups and downs of that. I'm more like community. Um, I'm more community and like marketing skill set, whereas my brother's more finance operations skill set. So it was a complementary, brothership there of running the practice together. And because we were building it over time, and there was traction at the beginning, and we just kept investing it strategically without taking too big of a risk. That's how we grew it over time. But yeah, 5 years goes fast when you're running a practice. But at the beginning, I wouldn't have said I didn't say I have a startup. I just said,
Mm.
oh, I'm making videos on YouTube and I'm seeing some telehealth patients. And then
Interesting.
I decided to. There was actually a turn. There was a moment where there was like three forks in the road or whatever. There was a fork in the road. I had three options to take. I thought, because I was seeing telehealth patients. I was like making a few $1,000s a month. Where I was like, okay, this is a real thing. I can quit my clinical job now and go into this full time. So that was also a conscious decision I made of like not going all in on this too early. If I had to do it over again, knowing what I know now, I knew it would work. So I would have done it earlier. But at the time, we don't want to quit our normal job to, go into the side hustle, our dream. So it was strategic. It was like slow and calculated. But there was this moment where my own capacity for seeing patients was kind of full. I was like seeing patients for around 30 hours a week. And there was a moment where it was like, okay, what do I do now? Because there seemed to be more interest of people needing help. The YouTube channel was still just like a few years old or 2 years old. So, or a year and a half old. So it was like, okay, option one, do I like increase my prices and become more of a premium service? Just, stay solo, increase prices? Or do I create an online course and try to like, digitize this experience for people? Or do I hire other audiologists like me who can do this service at a fair cost to the patient, and increase, and then like essentially start a brand where it's not just me, but it's multiple providers in the same like a healthcare practice.
Mm-hmm.
So as I reflected on it, and I thought this is such a good like direction of in these situations. I asked the question, what's really best for the patients? What's best for the people I'm trying to help? Like, what's best for the community? What's best for the group of people that have tinnitus, that are really struggling and need help? Well, in my experience, like hands-on, one-on-one, whether it's telehealth or in person, working with a specialist over many appointments over time, that leads to the best results. That's what's needed. So I decided to, bring on the first audiologist hire, and then essentially, grow the practice that way. And I'm so glad I did, because we have helped thousands of people. And if I just decided to kind of take my foot off the gas and slow down, we wouldn't have.
Wow. And I've read you've had an incredibly high success rate with cure for your patients, which is incredible.
In the tinnitus world, we try to not use the word cure, because a success for us would be someone comes to us, we say, hey, how bad is this problem? 1 to 10, 1, not a problem at all, 10, an extreme problem. The average person would come to us saying it's a 6 or a 7. A success for us would often be reducing that down to a 2 or a 3. Like in the world of tinnitus, that is a success. In the world of surgery, it's probably different, but in the world of tinnitus, it's more about, improving it at least 50% would be a big win, because there's millions of people that live with a mild degree of tinnitus and they live normal lives. It's just not an issue. So that's what we try to get our patients to.
I see. Okay, that makes a lot of sense. Thanks for explaining that.
Yeah.
I've had a lot of successes improving people's symptoms and just in general. Is there anything that really stands out to you that you're most proud of, that you and your brother are most proud of?
Well, I'm most proud of the doctors on our team who decided to believe in us. Sometimes there are moments where I look at the audiologists on our team that see a lot of patients, and I think, wow, I can't believe you decided to work with Treble Health. Like, this started very humbly, and now these very respected doctors who formerly worked at NYU in New York, UCSF in San Francisco, University of Miami, Florida, are choosing to work full time at Treble Health. It's like, that is like a whoa. I start to realize that this really has potential, and it already is something, but you start to realize like, wow, we have something that people believe in, and they believe in me, and that feels like a lot of responsibility in a good way. And they also see the benefit of working with this particular group of patients who struggle with tinnitus.
That's incredible. Well, what a true testament to your mission that people are willing to do that. I'm curious, is there a reimbursement landscape to discuss, or is reimbursement not part of the conversation, the way you structure things?
As of recording this video in summer 2025, we've been private pay. So the way that tinnitus works is that sometimes there can be insurance coverage, usually partial coverage through billing it under hearing loss treatment, hearing aid treatment, because often that is part of the recommendation for the patient. But tinnitus itself, I don't know the full details of this, but due to the history of professional groups and insurance coverage, tinnitus has sort of fallen through the cracks where it's often underinsured or not insured at all by itself. And that's disappointing. It's not my expertise. There's a few big problems we're trying to solve at Treble Health. That's really not one of them right now, but I'd like to see it change.
Got it. That makes a lot of sense. So I was really struck by this. I don't know if bespoke is the word, but this tinnitus 180 program and the way uh, there does not seem to be a one size fits all approach that you bring to the table, and seems much more tailored for patients. And I'm curious what that looks like. Like,
Yeah.
what does that feel like at the patient level when they're interfacing with Treble Health? What does that actually mean?
Yeah. So this is a condition that, yeah, like I had mentioned earlier, affects the nervous system, stress, anxiety, sleep. It can cause depression even. So there's a lot of nuances, and it's a very human, like human treatment in the sense that when it's personalized, we need to understand which of these 7 categories are affected for the individual. It's not so simple, just, oh, follow this, use this device, and over time everything will get better. You won't have to worry about it. We're often teaching people cognitive behavioral therapy techniques or tools for anxiety management. We're teaching a lot of people guided breathing. We have these 70-year-old tough men, for example, who come to us and we're teaching them guided breathing. And they say, I never thought I would do meditation, but this is helping my tinnitus a lot because it's settling their mind and settling their nervous system. So, there was a researcher in our field who, many years ago had said, researchers have the benefit of, you know, commenting or testing things in theory, but clinicians who are face to face with the patient have a harder job because they can't do what's perfect according to the textbook always. But we have to take the existing knowledge we have and try to present something that the patient will actually comply with and that it will get them better. So in tinnitus, that means we're taking different tools from CBT, from sound therapy, hearing aids, mindfulness, guided breathing, accountability, coaching. We're just really customizing it, and that leads to the best results for sure.
That's interesting.
And I wanted to highlight that this is very new. So this might not have come up in your research, but this week, we just announced that we opened 2 physical locations, 2 clinics. So the growth of
Wow.
Treble Health, which just started telehealth, and then about 3.5 years later, we're now entering the brick and mortar space as well, and simultaneously growing telehealth. But yeah, San Francisco, California, and Miami, Florida. Those are both Treble Health locations that are announced as of July 2025, and this is another moment where it's like, whoa, this thing is getting very real, and it has a destiny of its own.
Wow. Congratulations. I had not come across that. I'm so glad you shared.
Thank you.
Yeah, that dovetails with my next question, which was like, what is the next stop on the rocket ship for Treble Health? Like, what do you see the big picture, the bigger picture looking like?
Yeah. Well, I first want to address that. Um, I always like to highlight how if someone's story seems like, wow, it was so easy, like it really wasn't, and there were lots of moments of self doubt, of stress, of anxiety. Things weren't going so well. Things, we still have goals that are, bigger or better than where we are right now. But we certainly have grown over the last 5.5 years, and we've decided to pair the telehealth practice with physical locations and essentially creating this hybrid model. And I just spoke with a patient who lives in Jupiter, Florida yesterday. He's an entrepreneur, like started and sold multiple companies. He's been dealing with this really bad tinnitus for years. And I met with him on a telehealth session where we determined that he was a good fit for treatment, and he's going to start the treatment at our our South Florida location, which is in Weston, which is about an hour, 45 minutes north of Miami, very accessible for all parts of Florida. So he's driving about an hour and a half for this appointment where he'll receive the medical devices. He'll work with the specialist, former University of Miami audiologist, and then he'll have the option to do the follow-up appointments either in person or remote from telehealth. It just really shows us like the flexibility that this provides to people. Because a lot of people want an in-person fitting or device programming experience. They want the option to see their doctor face to face and, like shake their hand, get diagnostic tests in a certain way. So now we're able to offer this, and it's really exciting. It's the very early stages, but we see, if those go well as we predict they will, then we see that as our opportunity to reach more patients and grow the practice, because there's a lot of people across the country that don't have a good tinnitus specialist in their area.
Oh, that's fantastic. It makes such a difference to the right person to have the clinician right there in the room with them. Even just thinking about the perception of how long your doctor spent talking to you. And if I'm sure you've heard these studies of the doctor standing for 5 minutes versus sitting in a chair next to you for 5 minutes, the perception is so much more time spent talking to someone when they're seated next to you. And there must be some real incredible therapeutic benefit in these brick and mortar locations for your patients.
Absolutely. And that's exactly what we're trying to create, is a therapeutic experience for them where very different compared to going to other doctors and being told basically there's not much that they have, there's not much they can do. So yeah, that's our mission. That's what we're working on and building. And, I'm over here like, okay, we need a commercial lease. We need to find a space. We need to, buy a printer. We need to buy, equipment. So definitely learning new skills along the way too.
Oh, that's awesome. Well, what would you tell someone who is who looks up to you, who wants to start their own thing, do what they can? What would you tell someone who is still a student and wants to be you someday?
What I would tell them is,
what advice I should say.
Yeah. What advice I would say is, hey, what worked for me is make social media content. And you probably won't feel like an expert at the beginning because you're not. But as you're doing all this research for the topics you're talking about, as you're interviewing these, if you have a podcast, for example, and you're interviewing researchers, PhDs, specialists, physicians, suddenly after some time, I really did become the expert simply from working on it so much and absorbing so much information. So I think that's my message, is that you're not going to have it all figured out at the beginning. I mean, hearing my journey, I did not have this mapped out. So I think just, sailing in the ocean, what is on the horizon line, just sail there and then reassess and keep options open so that you can pivot. And ultimately, work is a tool for fulfillment in life. So just keep focusing on fulfillment in life and have fun.
Awesome. Well, where can people find you if they want to learn more?
Yeah, if you want to connect with me individually, you can find me on LinkedIn, Ben Thompson, Au.D, or Treble Health. You can send me a message or connect with me and share anything or reach out. And if we can collaborate or if I can help you in any way, please reach out. If you want to follow our practice, treblehealth.com, we'll have an update of the locations we have as well as the telehealth practice. And then our YouTube channel and TikTok are going full steam with content, so you can engage there as well.
Well, Dr. Ben Thompson, this has been such a joy. Thank you so much for talking with us today.
I appreciate it, David. Thanks for having me. It means a lot, and I wish you the best in your content and personal, professional endeavors.
Thank you.